And if you don't know, now you know, you know.
Hi, you guys, Nurse Misty and Dr. P, and you're here with If You Don't Know, Now You Know. So we're going to talk about some stuff that we've been seeing frequently on TikTok and Instagram. So let's talk.
What have you been seeing out there?
Oh, I haven't just been seeing it. I've had patients bring it in and tell me about it. What do you think about what they're saying that you should be taking more zinc, like 4 days worth before you get your neurotoxins done? And what do you think about that?
So there's some talk about that. There was a study out there a year or so ago. It was not a double-blind study. It was a systemic review. It's pretty anecdotal. The theory behind it is that zinc increases the bioavailability of the neurotoxin to the junction of the to attach at the neuromuscular junction, which is great theoretically. Do they know what dose? They're saying about 50 milligrams a day. Zinc is a great supplement to take overall for your neuromuscular system. It can be very toxic at high doses, so don't think you need to take a lot of it because you can develop a lot of problems if you do take too much. I would take what's recommended over the counter supplementation, or you can get it in your diet, like through, if you like oysters, some meat, crab is a good source, and nuts. I started taking zinc a while ago just for overall well-being because I don't have a great diet. So I have not noticed a change personally, anecdotally speaking, and I have other patients that have added the zinc with the phytase, which is supposed to be combined and synergistic, yada, 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 no change. So I think the verdict is out on that one. Just start taking it. It's great for you to take it once a day, and let's go from there. Next.
All right, another thing I've been seeing on the internet is a lot of people saying, which neurotoxin do you feel like makes you look more natural? What do you think about that? Do you think there's a neurotoxin that actually is different than the other ones that make you look more natural?
I think they all like to claim that they're different from each other, but down to the nitty gritty, they're all neuromodulators, and they all pretty much do the same thing. I think you can make it look more natural or more frozen based on your dosage and placement. So I do find that some patients find one more effective than the other. I really think that has to do with their biochemistry. There's some studies that talk about Botox brand versus Xeomin, and clinical environments that's more effective after so long. However, I think it's very individual, and I really don't have a hard science answer for that one. What do you think?
Well, I know which ones work better for me, and
And don't you find that's changed over time for you?
Oh, for sure. Yeah. No, for sure.
And that could be because our biochemistry's changed, or as we age. There's theory that you can develop immunogenicity to it. Botox brand likes to claim that there's no such thing. So really it depends on you and trial and error.
No, I agree. And if you find one that you like, and and then you try a different one, and you'll see which one your body actually likes better. Like that.
What we do know is that Dysport does clinically have a start time of taking an effect faster. Mm-hmm. So if you have an event in a week and you really were late in getting in, you want to go with that one. Otherwise, I would say go with what works best for you. The new neurotoxin that was FDA approved from Korea.
That's another one.
What's the name of it? Zyvo. What's it called? Anyway, that one, I personally tried it on a patient and found that it was very ineffective. So I'm interested to try it again.
What do you think about, a big talk right now because they're rebranding is Daxxify. What do you think about that?
So Daxxify kind of shot itself as a company in the foot by claiming that it lasted for 6 months, which we all found out that it doesn't in the studies, maybe 5-10% of patients. It was very expensive. So now they're trying to rebrand and change pricing and come out and say that it's the same, like it lasts the same amount of time. So we'll see. I mean,
Yeah, that would be something
when
for
a
you to touch
company
base
comes out and makes false claims, it's really hard for me to re-engage with them because I feel like they were dishonest, purposefully or not. I don't know. So we'll see. We'll go from there and try it out maybe once again and with their new indications and see if they can redeem themselves. As Jeuveau tried, but I'm not a fan of Jeuveau either. But that's all personal, opinion.
Those are pretty much the main topics that I've been seeing, like over and over. The zinc one's a big one. Patients have been really talking.
You know what I've been hearing about is Jamie Lee Curtis just came out yesterday saying that plastic surgery is the genocide of womankind. And Dr. Terry Debrow came out and said that is, she needs to stay in her lane, and that you cannot compare genocide to plastic surgery. Which I totally agree. I think she was trying to emphasize how she doesn't agree with
she probably just used.
However, using that term in this type of climate, I think was very irresponsible. What I would say, it's everyone's personal preference. I don't think you should try and fit into the mold of whatever you see out there. You should be true to yourself. I personally like this field because I like to feel that like the best version of myself, not particularly like a different person. What do you think about that?
I don't know. I feel like the internet has a little bit of a pull on our younger generation, so I feel like they are going to do what they see.
So you think we should be a little bit more responsible?
I think.
You know what it is? It's the filters.
Oh yeah,
that's the problem. Because who's going to look like a filter? They come and tell me, "Hey, can I look like this filter?
Oh,
hey,
can I have these? Can I have these lips? Do you think?" And I'm like, "Are you?"
So maybe we should walk around like avatars. The next thing. I don't know. Maybe that's the next thing. Let's create an avatar. All right.
All right.
See you next time on.
And if you don't know, now you know, you know.